Hi there, everybody. This is Lee, and I just wanted to make sure that people still understand that reproductive rights for women, family planning, access to affordable quality health care, that this is a matter of economic rights, economic justice for low income women, that these services, family planning, reproduction, affordable health care, are in the process of being attacked and actually sustained attack, direct attack underneath the Trump administration, that many services are being cut and defunded, and that abortion services were defunded back in the 1970s already, and that now it's not just abortion services, but every other kind of service, specifically for women, ovarian cancer screenings, breast cancer screenings, uterine cancer screenings, are being, funding for that is being cut, and that contraception for women is being cut. Um, General preventative gynecological treatment is being cut. The yearly exams. All of that is being attacked through the defunding, and that many people do use Planned Parenthood because it's the only provider with comprehensive treatment in certain locations. And that if you're in a rural location and maybe Planned Parenthood is maybe 15 minutes away by car, and then Planned Parenthood is defunded and you have to actually drive for an hour, that puts a burden on women. And so it's not something that can be dismissed when it's a life or death situation for women. That sometimes these yearly exams are when life threatening issues are caught and are still treatable. And that it is an issue of economic justice. That maybe if a woman cannot even afford a car or afford the gas, or something to transport herself and maybe her children because she can't afford child care, that she has to take the kids with her. um, these are issues, and that even the issue of family planning has economic repercussions. That sometimes an unexpected pregnancy means that you cannot seek out employment, or you can, and the employer is like, oh, I guess we're looking for someone different after they notice that you're pregnant. Or, you get pregnant on the job and you take your leave and you try to get your job back and it's been given to someone else because it was at will employment, like a lot is these days. And so there are issues, and that maybe if you're of a certain income, you simply cannot afford another child. That if you have another child and then these three that you already have will not eat, what do you do? And so it's a matter of human rights, human justice that's being attacked, and that women are tired of serving as collateral damage for progressives, for liberals, for centrists, for conservatives, who want to be stars and use women to do that. They're sick of serving as collateral damage. And that right now, healthcare is under attack, that we know the importance of healthcare. I've spoken of Medicare for all on this channel many times, including Medicare for low income women, that everyone should have access to the healthcare that they need. And so right now, there's a lot of defunding of services specific for women. And so it's a problem. And many women are responding by attending campaign schools. They are learning how to run for office. That there's a great imbalance at the national level of women not being represented in accordance with their population, that men are actually overrepresented, and that we are seeing the results of that. Not only in the U.S. Congress, but even in the presidency, which is 100% male representation, that there's been 80% representation of men in the Congress, even though they are maybe 49-50% of the population. And that even at the state level, we see that the percentage is, maybe 24% women And again, men are still overrepresented at the state level as well, the governorships and the state houses, the state legislatures, the assemblies. And so women are running for office. They're apparently they've learned or figured out that they have to protect their own rights. That waiting and hoping that a progressive will protect, women's rights for them is a dicey game. That when backs are to the wall, that some men will throw women and their health care under the bus in order to prove a point, to work across the aisle, to, whatever. And so women are protecting their own rights. It looks like that's what's happening, and it needed to be done. And that there's been a tendency for men in general, but even progressive minded men, to attempt to reprimand and lecture and shame women into silence, to belittle them and to tell them that they need to in order to protect the greater picture, the bigger picture. And women have compromised and negotiated and compromised and negotiated until now we're at the point where this is where we are, that women's backs are to the wall, and that their health care is under the direct threat. And so there's also an effort to separate this as a social issue or a cultural issue, healthcare for women, and it's not. It's a healthcare issue. It's an economic issue, specifically when it comes to reproductive rights. And the fact that there's an effort to defund access for low-income women, that means it's an economic issue. Okay. And so now for Heath Mello, and there's been an attempt to dismiss and silence women on this issue. No, Heath Mello has to answer for his public record. No one went through his garbage can to learn his secrets. He made public decisions on public tax dollars while serving as a public servant. So his record is public, and people can read. So it's a public issue. And so it's now in the public domain to discuss that Heath Mello has co-sponsored and authored legislation that interferes with women's rights to self-autonomy and healthcare decision making. And women find that unacceptable. They would find it unacceptable in anyone. They find it unacceptable in Heath Mello. Never mind that Bernie Sanders decided to endorse him. That doesn't give him a pass for what he has done. It just brings Bernie Sanders' decision making into question. And people have a right to question that. As a state senator, Mello co-sponsored a 2009 bill. He was a co-sponsor. No one forced him to do that. He decided to do that himself, requiring doctors to offer ultrasounds to abortion patients, basically interfering with private decision making between a physician and a patient. Heath Mello did that. And that's not all. That he also sponsored a 20-week term limit on abortion in 2010, 1 year later. And that he also voted in favor, he voted up stripping abortion coverage from insurance plans in the state of Nebraska. Again, he decided to do that. No one forced him, and it wasn't an accident. He voted on this, he voted on this, and then he voted on this. It's pretty consistent. He also voted to ban telemedicine abortion care, which made abortion less accessible to rural women. And then for all his votes on these issues, Heath Mello was endorsed by the Nebraska Right to Life in 2010. And so these were public decisions that he did. This wasn't just thoughts that he had or feelings that he had on abortion, saying like, well, I feel pro-life. No, he actually made public votes, translating his pro-life beliefs into actual harmful legislation for people in Nebraska. So these weren't thought crimes. He actually created co-sponsored legislation. And so now he's got to answer for that. And so his record came under fire, and he claims that he would never do anything to restrict access to reproductive health care, but he already has as mayor, but he already has as a state legislator. And so, can people depend on him? Can women depend on him based on the fact that he's, anyway. So, the question is, Bernie Sanders, who's endorsed Mello, who, claims that he's pro-life in thought, but, many people are pro-life in thought. Many women are pro-life in thought. In fact, who is anti-life, really? Can we can we use common sense, please? No one's really pro-abortion or pro-death. That most people are pro-life, but that abortion is a part of women's health care. That's just the beginning and the end of it. When abortion sometimes has to be done for whatever reason, that there are too many reasons to really legislate around, that these are private decisions between a woman and her physician, and that politicians hoping to become rock stars of the progressive movement or even the conservative movement or the neoliberal movement should not be using women as collateral damage in order to do that. And so it calls into question judgment and opportunism. And the fact that Tom Perriello, he's a lieutenant governor, he's wanting to run for governor. I've spoken of the Virginia governor's race several times on this channel, and the issues surrounding that. Terry McAuliffe is about to be term limited out. Terry McAuliffe is pro women's rights, that he's voted down legislation harmful for women. However, Tom Perriello is questionable, that he also has a public history, like similar to Heath Mello, that Perriello voted for the Stupak-Pitts Amendment in the Affordable Care Act. And basically, it was a form of attacking reproductive rights. The Stupak Amendment was an anti-abortion type of poison pill. It was an addition to the Affordable Care Act that nearly prevented healthcare reform from passing, and that's what Perriello voted for. And so some people describe that as a type of, again, showboating and using women's healthcare to do that. That Stupak and 63 other Democrats, including Perriello, threatened to block a vote on Obamacare unless people who receive subsidies were prevented from using their own private dollars to purchase plans, including coverage for abortion care. And so it was not really a continuation of the Hyde Amendment that already banned federal funding for abortion. And that's how Perriello tried to explain that. It was actually a pretty significant departure from insurance industry norms. And so, it all adds up, and that Bernie Sanders is supporting Perriello as well. And so these things are starting to add up, that there's a really dismissive kind of way of viewing women's rights when it comes to healthcare. The mandatory waiting periods, all the second opinions that are necessary, the interference between physicians and gynecologists with their patients, forcing internal ultrasounds. And these are all just kind of questioning women's reasonable ability to make up their own minds about what they want to happen with their own bodies, and that it actually places men in an authority over women in their decision making, since most men are the majority at the federal level when it comes to laws, and then also the state level as well. And so these are concerns, and that women are drawing a line in the sand, that they've negotiated and compromised to the point that their backs are against the wall now, and that women are speaking up for themselves despite of the fact that they are being systematically silenced and belittled and shamed and lectured to and reprimanded, they are speaking up and speaking out. In terms of progressive politics, like who is a progressive, and can you be progressive and say Black Lives Matter? Can you be progressive and say women's rights? And some men seem to think no, that if you address these issues, then you are not a progressive. And I say Shirley Chisholm each and every single time that she was one of the most progressive members of the U.S. Congress when she was voted in. She was a Black woman. She stood up for women's rights systematically, over and over and over. She protected women while she was in office, and that she was in favor of, healthcare, education, that she hired women, she mentored women, and that she ran for office despite the fact that she was attacked even by her own party, and even by men of her own race, for being a woman trying to rise in power. And so, yes, women can be progressive and speak on women's rights, and that Black women can be progressive and speak on rights for Black women, or even rights, racial rights, and that Latino women and women of other races as well can speak up for their race, their culture, their gender, and still be progressive. In terms of progressive politics, these days, I submit to you Jill Stein, Nina Turner, Tulsi Gabbard, Shri Hankala, Winona LaDuke, Cynthia McKinney, who stood up for women's rights. Most of them were Greens, standing up for women's rights because that's a part of the Green Party platform. And I do believe that Dr. Jill Stein was the one presidential candidate in 2016 who consistently struck the right balance between women's issues, reproductive rights, economic justice, gender diversity, and ethnic diversity, and then also the environment, and then also foreign policy, that she struck the right balance. And that's because she was part of the Green Party. The Green Party supported Black Lives Matter, indigenous rights, women, LGBTQ, criminal justice reform, and then also foreign policy responsibility. And she did it without fear. She did not compromise. The Green Party hits the mark each time because they have the 10 key values, and it was part of their party's platform back in the past and today, that they don't apologize for supporting these issues, that there's no backpedaling, there's no distancing, there's no compromising, there's no negotiation, there's no dismissing, and there's no excuses. And so I'm going to point out a few of those. Social justice and equal opportunity is part of the platform. Also nonviolence, which speaks on war and demilitarism. Also feminism and gender equity. They say that we have inherited a social system based on male domination of politics and economics. We call for the replacement of the cultural ethics of domination and control with more cooperative ways of interacting that respect differences of opinion and gender. And also respect for diversity. We believe it's important to value cultural, ethnic, racial, sexual, religious, and spiritual diversity, and to promote the development of respectful relationships across these lines. And so they've been consistent on that. And, I feel that some people are trying to so eager to defend Bernie Sanders that they're willing to overlook a lot of things that actually have been done. That no one had to go through through Heath Mello's garbage cans to discover his secrets. That he actually made public votes harmful to women, and that Tom Perriello has made threats when harmful to women's rights on reproduction when it came to passing the Affordable Care Act, that he made threats. And so these are part of their public record. They went on record. They've made public statements, Perriello has. And, it's, you know, on these issues, they're weak, actually, and that there is a concern and that should be addressed and they should be made to face what they have said and what they have done harmful for women. And women are not going to negotiate and compromise on this. They are not going to silently stand by and support people who are harming them, and they shouldn't have to. And there are progressive men who I feel should not expect them to do that. So, it's a new day. Women are not going to take that anymore. The expectation that they allow themselves to be abused so men can feel, more ethical or moral or something. Women are not footstools for men to stand on to, rise to power. Not anymore. Good luck.